This is Health Education in Different Settings, Part 2. It will last approximately 30 minutes and is the end of the presentation that you would have already seen on different work sites. The purpose of this presentation is to finish going over different places where health educators are often employed. It is meant to be a supplement to your textbook. In the last presentation, we went over the following sites. We went over the health department, volunteer agency, healthcare setting, and worksite wellness programs. Each of those is unique in how they're regulated, how they're funded, what type of prevention is conducted, the audience, and the data that will be required for you to collect. We will now move on to the school health setting. In the school health setting, regulations and policies are based on federal, state, and local policies. School settings are regulated by a variety of different organizations and groups, and they must meet the guidelines and policies of all the different groups that regulate them. Their money comes from state, local, and federal dollars, which means there will be public scrutiny of everything that is done in the school. And sometimes they receive grants. If the grant comes from the federal government, that is tax dollars also. If the grant comes from a foundation like the Bill Gates Foundation or the Robert Woods Johnson Foundation, those agencies will also scrutinize what is done with the money. The philosophy varies from school to school. However, most schools focus primarily on primary prevention, and some secondary prevention. It depends what part of the school program is involved. In primary prevention, that is usually the prevention that occurs in the classroom with students. And the secondary prevention that occurs could occur through the school health services in helping students with diseases or conditions that have occurred. The audience in a school setting is typically captive. They are there, they're in your classroom, and they have to participate in your class. So it's very easy to get to them because they're there. And the other easy thing about this audience is most students are really excited to be in a health class. The data that you are required to collect varies greatly. However, most data at this point is based on whether or not students are meeting state and federal guidelines in the curriculum or the core standards. This slide should not be new to anyone. It's a visual of the coordinated school health model. And what it says is there are a lot of outside agencies that participate in the school program in the middle, and all of those items in the middle lead to an improved quality of life. The first item is the community and parents, and what's critical about this is that everyone realize that parents are the #1 primary educators of students. You can never ever take on the belief that it is us versus them. Parents must be working with you in a health program in order to make it successful. The second box is what most people think of when they think of school health, and that is the instruction that occurs about health in the classroom. The next item, physical education, is the physical education program. Physical education is based into two main parts. The first part is the teaching of lifelong activities, and the second part is the teaching of organized sports. If physical education is done correctly, it is very difficult because the educator has to balance lifelong activities such as bowling, badminton, volleyball, with those organized sports, lacrosse, football, baseball, soccer, so that students learn both long-term fitness and they also learn how to cooperate on a team. And they also learn the basics of what team sports are in case they participate in recreational sports, or they participate in high school sports, or college sports, or professional sports. Mental health service refers to the counseling services that are available in a school. Many students come to school with issues that are involving emotional issues, and they require special services. So you have guidance counselors in this area. Guidance counselors often run groups for students who have special needs like loss of parents, or a parent who's drug addicted, or they've lost a sibling. So they also run groups. They also look at issues that are related to mental health that might affect the student's success in the classroom. In there also you have something called PPW, or a pupil personnel worker, and this is called different things in different school systems. But the pupil personnel worker works directly with parents who are having issues. One of the major issues that's usually addressed is attendance. So if a child has an attendance issue, this person, the pupil personnel worker, may make home visits and may be the person who actually initiates the paperwork for court for attendance. Another part of mental health services might be psychological services that are related to IEPs. And you also have psychological services through people like psychologists and social workers that the school may hire. For example, when I was an assistant principal at a Title I middle school, we had a social worker. We had a grant because we were a Title I school, and we shared a social worker with one of the elementary schools. This meant that social worker would work with families from the time the child entered school in kindergarten all the way through 8th grade. That was very beneficial because the social worker developed history and rapport with the families and was able to work with all the schools involved with that child or the family. Those are some examples of mental health services. The other example I want to talk about is student assistance programs. And student assistance programs are typically programs where students or teachers can submit names of students who they think are involved in drugs and need some intervention. On that student assistance program team, typically you have the guidance counselor, the social worker, the pupil personnel worker, one administrator, and the school nurse typically sit on that team, and they review the names of the students and develop plans of how to proceed with each student. Sometimes the school police officer is involved also. Health services refers to the clinical services provided by a school. In most schools, there are registered nurses. Some schools have health clinics with nurse practitioners. The health services that are provided could vary from giving out medications to vision and hearing screening to sometimes diagnosing issues that need to be sent to a medical location. If you are working in a Title I school, which is a school where poverty is very high, it might be possible that a child is injured on a Friday after school and does not receive any medical attention until he or she returns to school on Monday morning. An example that I will share with you that I actually saw was a student actually got injured on a Friday night and broke his arm, did not seek any medical help over the weekend because the parents could not afford it. They were working poor, they did not have insurance, and they made too much money to be on medical assistance. And the child wasn't on the CHIP program for insurance for children. So the child received no medical services, and when he came to school on Monday, the nurse diagnosed it as a broken arm, and he went to get it casted. But that child went all weekend, and if there were not a school nurse in the building, sometimes families have no idea how to access health care other than the school nurse. Food services relates to the food that is served in the school. There are breakfast and lunch services. Some after-school programs have after-school food. All food that is served is required to follow regulations given by the USDA. The USDA dictates the amount of carbohydrates, proteins, fruits, vegetables, and dairy that are required in every meal. Different things have happened in looking at how those meals are created. One of the problems is you cannot just create healthy meals if the students do not eat them. So there's been a great deal of attention spent on how to make healthy meals more attractive to students and affordable. An issue that's come up recently is breakfast programming. All the data show that children are more likely to eat breakfast if it's served in their classroom. So most schools no longer serve breakfast in the cafeteria. The students pick up their breakfast and take it to homeroom or their first period class, and they eat it there. Just like some students receive no health services outside the school, if students are living in poverty, it is likely that they will not have much food outside of the school setting. That means on a Friday at lunch, a student may get a lunch and may have little to no food all weekend and not receive food again until Monday morning. So those are critical issues. Lots of times people talk about vending machines and the type of foods that are in vending machines. Schools receive half the profits on those vending machines, so they are huge money makers. However, most schools do not have unhealthy snacks and sodas in the machines anymore. They typically have healthier choices, and the vending machines must be a certain distance away from the cafeteria, and most schools only turn the vending machines on after school hours, so there's snacks available at after school events. The school environment refers to a healthy environment. The mental health piece is covered under mental health service, but the environment will refer to things like mold, sick building syndrome, asbestos, or lead paint. Those are examples of things that would make an environment unhealthy. And the last component of a coordinated school health program are staff programs or worksite wellness programs like the ones I discussed in the first part of the presentation. School systems are very interested in saving money, but they're also interested in setting role models for students. If the staff participate in wellness programming, that means they will be modeling healthy eating and healthy exercise for the students at the schools. If students see the adults in the school building, the cafeteria workers, the custodians, the clerical staff, the counselors, the teachers, the administrators, all participating in healthy behavior like walking programs or after-school fitness programs, the students then are more likely to model that behavior and also display healthy behaviors. The goal of all of these programs is to have an improved quality of life for children and their families. Success and failure. You must have age-appropriate material in schools. And age-appropriate material is designed to meet state and federal regulations. If you want to get into a lot of trouble in a school setting, you should teach something that's not age-appropriate. So you should never go outside what's in the curriculum. A lot of time and attention is spent on developing a curriculum that is spiral. Most school systems have a spiral curriculum, which means health is taught at every grade level, and it is age appropriate. So for example, because students begin to use marijuana, the data indicate in high school, the first time marijuana is really addressed is in 8th grade. Because children typically begin smoking in middle school, smoking is addressed in 5th grade. So all of the times where the behaviors begin, that is where it's been decided when to put that information into the curriculum, so it's introduced slightly before the children would begin the behavior. Parent involvement is critical. That's part of the school health model. And I've already discussed the parents are your friends, and you need to make sure that the parents are always with you in what you're doing in the classroom. Your partnerships are going to be within the school with the different groups in the school, the teachers, the custodians, cafeteria workers, the counselors, the pupil personnel workers. You have to have a good working relationship with them. You also have to have a strong working relationship with the community so they respect your programming. And sometimes you're involved with outside agencies. For example, if the Cancer Society has a program they want to do in your school, you would develop a partnership with the Cancer Society. If you're doing any type of training or after-school activities that require health instruction, your partnerships and relationships with those outside agencies will help you get a lot of free material for your students. And the last item that we've been talking about with each site is public relations and public image. So I'm going to give you two examples of items that seem pretty small but could have destroyed programming. The first one is about a mailing to elementary teachers. When I was the AIDS education specialist for Baltimore City Schools, we were training the lead teachers in every elementary school. So there were about 70 elementary school teachers who we were going to train. There was a handout that went with the training that my supervisor felt it would be important for the teachers to have before the training. And it was titled, How to Talk About Sensitive Topics with Elementary School Students so that your answers are age appropriate. And there were questions on there like, what is a condom? What is sex? What is butt sex? What's a drug addict? And so there were very clear directions on the ways that the answer should be given and phrased and guidelines. We were waiting for approval from upper management, the superintendents of the different parts of the school system, and we weren't getting anywhere, so my supervisor decided that we should mail that out without permission. So we sent it down to the mail room, and it's in 70 mail bags for elementary schools. And we get notice, actually I got a phone call that night at about 7 p.m. that the superintendent said that is not to go out before the training. And well, it's already in the mail bag. So my supervisor called me around 7 o'clock at night and said, you need to meet me first thing in the morning so we can pull all the mail. So I got to North Avenue around 6 o'clock in the morning so that when the mail room opened, we'd be there. We had no system whatsoever on how to pull these letters. But we ran in the mail room and we're pulling mail out of every mail bag like a bunch of crazy people. We must have looked like idiots. I'm sure the mailroom people thought it was hilarious. And for some reason, we were really good at pulling all the mail because we didn't miss any elementary schools. None of the letters went out. However, despite the fact that that was some really small item, if we would not have pulled those letters, if those letters would have gone out after my supervisor had been told not to send them, that would have been a huge issue for our entire department because we were not following the rules. The next example I'm going to give you about a way to get in trouble is about teaching condom usage. So soon after I graduated, there was a teacher in one of the Maryland school systems who was teaching 8th graders how to put condoms on. 8th grade is approved for condom teaching, and you can actually show condoms in 8th grade. So at that point in time, that was all approved. So teaching how to use a condom was not a problem. She used a banana to teach them how to put the condom on a penis by using the banana as a penis. It would have been much better to use a real penis, a model of a penis. So she put the condom on, she showed them how to do it, she took the condom off, and then she ate the banana in front of the class. Well, the parents went ballistic. This was a relatively wealthy community. And so she lost a lot of credibility in her community. She was a relatively new teacher, and she had just started to gain respect of her parents, but that caused her great setback. Again, something really small that you might think is not really that important. The perception of the community was huge. And so you always have to stop and think about what you're doing when you're working with children and how their parents or the community will respond to what you're doing. So if you always follow exactly what's in the curriculum, when parents get upset with you, you can say, that's what's in the curriculum, I'm required to teach that. And it takes a whole different perspective then, and people at the school system level can come in and help support you. We're going to move on to university and colleges now. And university and colleges are very similar to school settings, other school settings, K through 12, except it is a very relaxed atmosphere because of academic freedom issues. Because universities are required to have academic freedom, a lot of content that might not be acceptable in other places is acceptable or more acceptable at a university or college. Colleges and universities are funded just like K through 12 through state, federal, and local dollars, and sometimes they have grants. Sometimes they have millions of dollars in grants. So the granting agencies dictate how that money has to be spent, and the state, federal, and local government all have had times where they've stepped into a university or college and stopped a program because of political pressures. Philosophies vary from one site to another, but most universities and colleges typically only focus on primary and secondary prevention. Primary prevention would be things like the peer educators at Towson who do drug education prior to there being any problems. Or it could be a health fair that's conducted at the school setting, or it could be counseling sessions that are set up for stress management. Secondary prevention would be examples, for example, would be teaching people how to use condoms after they've been infected with an STI, or helping people learn how to use their medications if they've gotten the flu. Those would be examples of secondary prevention. The audience is captive primarily, depends on where you're working in the university, on how captive they really are. They are considered adults because they're over 18, and so there's a lot more freedom in what you do with them. And the data that are required to be collected vary greatly depending on the university or college, where the funding is, whether it's a grant or tax dollars, and it also depends on what focus is happening at that university at that time. Just like K through 12 schools have a coordinated school health model, that same model is in place for universities. The parents play less of a role in this model, but the community plays a huge part. If you're at a university that has a tremendous amount of underage drinking and it negatively impacts the community, there would be issues. So, for example, at Towson, there are some very family-centered communities very close to the university. And if negative university behavior were impacting their families in a bad way, there would be issues that would need to be addressed. The health instruction typically occurs in classrooms like our class, or in Health 101 or Health 220. Physical education occurs at the universities, and most universities require at least a half accredited phys ed to graduate. Mental health services typically exist in the health center, and they could be from individual counseling. It could be working with a student on anxiety disorder, that somebody could have lost a family member, someone could be depressed. So there's a variety of mental health services that happen at a university. Then there are the health services, things like prescribing medication for people who are sick, they have strep throat, they have the flu. A lot of universities provide contraceptives, and they also provide the day after pill, the morning after pill, to use as a contraceptive or your choice B. Food services, all the universities has food services. Food services are not critically, they're not managed the same way as they are in K through 12 schools because they're not regulated by USDA. And the main goal at universities is to provide healthy choices, a variety of foods, and all foods that are affordable to students so they can afford to eat. The environment at a university, beyond the lead and asbestos that I talked about in K through 12, you also have the safety issue, and is the campus safe? Is it well lit? Are there escorts to cars if it's late at night? What is the rape prevention and violence prevention plans for the university? Is there an active shooter plan? Is it practiced? So all of those types of things would be examples of a safe environment. And in a college or university, there are often staff wellness programs, just like there are in K through 12. These are the places that you might work in a college or university. You might work at the health center. You might be a peer educator. You might do sex education. You might do outreach to fraternities and sororities. You might work in an employee wellness program that's specifically designed for employees only. And then a lot of universities and colleges have wellness programs or fitness rooms, and those could be utilized by students or employees. So there are a variety of places that you could actually work in a college setting beyond the classroom. The classroom is obvious, but these are other places other than the classroom where you might work. Successes or failures in this setting include partnerships. Your partnerships could be with almost any agency, a school system, a health department. You need to know the rules and regulations and work within them so you don't get in trouble. You need to produce data that demonstrate your success. and you have to be very aware of your public image within the college, within the groups at the college, and within the population outside the college, the neighborhoods and communities nearby. Another place where you might work as a health educator is a professional organization. These are organizations that people belong to as professionals. In the very beginning of the semester, I asked you to look up some of these organizations. They included American School Health Association, American Public Health Association, SOPHE, SHAPE, and a few others. It's important for you to join a professional organization, and it's much less expensive if you join as a student. These organizations are self-regulated, and they're funded through dues or government funding or grants. Typically, because they are self-regulated, that means that all the members oversee what is happening, and so it's the members who might critique how things run or how the dues are spent. The philosophy of the professional organizations is usually to improve the profession in some way. And when you review these professional organizations in the beginning of the semester, it was important for you to understand how they improve the profession in order to choose the one that was best for you. Most of them do not do prevention, although some of them do have an arm of their organization that works on public policy or prevention programs in communities. A lot of what they do is professional development activities for the members. The audience is paying members, and the data that they are required to collect varies greatly. It depends on what part of the program it is and whether or not it's a grant. So data vary tremendously. Successes and failures. You need to know your membership needs. If your members need continuing education units, then that's what you need to do. If your members need you to develop a program where health educators are going to get compensated as third-party billers with insurance companies, then you need to work on that. Whatever the membership needs are, you need to respond appropriately and set those programs up for your members. And your PR, public image, is going to be among the professionals, whether they belong to the organization or not. And sometimes professional organizations develop reputations outside the profession, where they're seen as a leader in some aspect of health or health education. The very last type of employment that we're going to review is employment at a faith-based organization. Most faith-based organizations have policies and regulations that are based on the faith. So if you work in an organization that is faith-based, it's critical that you are aligned with what their beliefs and policies are. If you are not aligned with their policies or beliefs, it is often very difficult to implement programming for which you feel is effective. Their funding is usually by donations and grants. The philosophy varies greatly. Different organizations, even within one religion, can vary greatly. Faith-based organizations also participate in primary, secondary, and tertiary care. They often hire nurses to participate in secondary or tertiary care of members. They often do a lot of preventive services in their communities. And they often work with other organizations to make everything happen. The audience is typically members of the organization. So if it's a Jewish-based organization, typically the members are part of a Jewish religion. If it's Christian, then they're usually part of a Christian organization. If they're Muslim, they're part of a Muslim organization. Although that is not true across the board, it is a general guideline as to who the members of the organization will be. And the data needs vary greatly. Success and failures. You need to know your organizational beliefs and values. You need to be able to operate within those policies and regulations. If you have strong beliefs that are different from the organization, you're going to have huge problems working there. And it would probably be a good idea to make sure that your beliefs and values align before you take any position, but most importantly with a faith-based organization. You're going to have a variety of partnerships. You might partner with other faith-based organizations. You might partner with Cancer Society, Heart Association, Health Department. You might be partnering with a school system or a university. The partnerships are huge in faith-based organizations. You have to know your members, so beyond knowing what the policies and regulations are of the organization, you really have to know the members of the organization and understand their cultural beliefs and values. And your PR and your public image is critical because whatever programming you do, you need to make sure that the public image within the organization is good and the public image outside the organization is good. So in summary, these are some really important issues to be successful as a health educator. The first one is networking, and I know you guys hear this all the time, but it is so very true, and we will discuss it again later in the semester. Who you know is going to help you tremendously when you try to implement programming. You need to look around the room the next time we're in class and realize that at least half of those people you will probably work with for the rest of your life as a health educator. It is very important that your relationships begin to develop when you're in college because you will see those people throughout your career. There are probably 5 or 10 people that I see now that I still see that I saw when I first started 30 years ago. Some of the people who supervise the internships where you go, I actually worked with 30 years ago. So it's very interesting how your paths continue to cross. So those relationships and networking are critical to your role as a health educator. Knowing your organization and your organization's expectations are critical. You have to know what they expect from you so you're providing what they expect. You have to know your population, and this is very much related to the last item. You need to know what your population's beliefs and values are, and you need to develop programming that addresses those items. And you need to respect the cultural diversity of your populations so that you're able to maintain a strong public image and public relation with the communities you serve. Internally, for public relations, you need to be able to network within your organization, you need to be respected within the organization, and you need to be able to create data that indicate that your programs are successful. This will help you develop that respect of others inside your organization. So that concludes the presentation part 2 on places where health educators could work. It's important that you also read the textbook because there are a few examples in the textbook that were not covered in the slideshow. And also your next assignment is related to this slide presentation. It asks you to identify your top 2 choices as to where you would best fit, and you need to explain why those choices are best for you. This concludes the presentation on health educators and the different settings in which they might work.